I'm absolutely certain that everybody in this room and millions of people out there outside would all agree that the idea of transforming the lives of those 5 million people on benefits is absolutely what we should be doing. A terrible waste for society, a terrible waste of money in practical terms. And you're not only throwing a challenge down for those people who themselves, but you're also throwing a challenge down for the voluntary sector. And I suppose this is the opportunity for the voluntary sector, for all of you, to perhaps ask some of the difficult questions, perhaps, that you might have. So, who's going to kick us off? Yes, there's one down here.
My question to you is, do you think there's a risk in the way that you've set this thing up that a lot of the expertise that exists in the voluntary sector, that exists in local councils, will be squeezed out from the work programme? We look at the primes in the area that we're in now in London. I think initially 14 out of 16 were from the private sector, only 2 that were not for profit. You look at the way that the payments are set up. You look at the kind of figures that some of the primes are asking for, where they're saying that they want to take 30% for supervising a voluntary organisation. We worry about what will happen when we see the contracts come out that all the subcontractors might be private sector and the expertise in the voluntary sector lost. We look at what's happened in the past where, the kind of payments you talked about, which was 4,000 for the easy case and 14,000 for the more difficult ones. As you know, probably better than me, what's happened in the past is that the private sector's come in, creamed off the easy ones and left the more difficult ones. So my question is simply, do you think that the expertise that exists in the voluntary sector may be squeezed out by the work programme?
Okay, another question. Yes, sir.
Dino Patel, National Housing Federation. And the question I want to ask the Minister is that he mentioned about payment by results, and to an extent I agree with that. And he also mentioned that there are lots of vulnerable people that we have to deal with. Just getting somebody into work is not the end in itself. People also need a lot of support after they've got their job, and you need to spend a lot of time sustaining them in that job. And I just wanted to know whether there will be any money available for that sustainable part of it.
Thank you. Another question. Yes, there.
My name's Chrysanthe Geodis. I'm from Social Enterprise magazine. Provocatively, I want to ask whether the Minister actually truly believes in his powerful idea, because surely the logical conclusion would be that if you're taking a black box approach and allowing innovation to flourish and the professionals to make up the decisions, then the professionals should decide how they're paid. And that's not what's happening in the work programme. You've got 8 different categories of payment which have been set by Whitehall. So has this powerful idea been taken to its logical conclusion?
Okay, Minister, would you like to rise to those challenges?
Right, on the first point, the voluntary sector shouldn't be squeezed out. We've been very clear in saying to the would-be prime contractors, and we've got, if you look at those on the framework, we've got roughly a third who are either from the voluntary sector or are consortia of voluntary and private sector. So we've got a number of our leading charities have actually teamed up with private sector organisations, but as joint prime contractors rather than as subcontractors. So there's a good, and in fact better than I thought, presence amongst the prime contractors. But most importantly, what I've said absolutely clearly in so many words, face to face to all the people on the framework, to all the voluntary sector organisations who have bid for, who expressed an interest in the work programme, indeed any other group I can find. The first thing is there are 2 safeguards in this for the voluntary sector that mean your hand is a pretty strong one in all of this. The first is that we have said very clearly to the prime contractors, we expect them to bring, to pick a current topical phrase, a coalition of organisations with them who have the mix of expertise that they need to demonstrate that they can help all the groups we're talking about. And that means using the best of the voluntary, the community sector, social enterprise and the private sector together. If they don't bring that group with them, they'll be straight to the back of the queue for the contracts. Basically, they're not going to win. So anybody who doesn't turn up without that team with them won't get a contract. So that should start by strengthening the hands of all those groups in the discussion, because if all the groups turn around and say, we're not dealing with you on those terms, away you go, then the prime contractor can't get a contract. So that strengthens your hand from point one. In terms of, do you then get squeezed out subsequently? The second thing we've done is to introduce a code of conduct, commercial code of conduct for our subcontractor or our contractors called the Merlin Standard. And to explain it in simple, non-technical jargon, what the Merlin Standard does is say, if the big guys stuff the little guys, then we'll stuff the big guys. And if we end up with a situation, as I know has happened in the past, where a prime contractor wins the contract with a sexy list of subcontractors and then dumps them all the day after, then we'll be dumping the prime contractor pretty quickly, I can assure you. So, and again, that has been said to them in so many words, very clearly. And if they haven't got the message, then, well, I'd be surprised. Now, what I can't guarantee, and I can't do, is I can't conduct every negotiation for a voluntary sector organisation with a would-be prime contractor, and I can't dictate the detail of the commercial arrangements that are reached. I'm working on the assumption that you guys aren't going to do a deal that does you down financially, that makes it impossible for you to function. I mean, of course, there's going to be a robust commercial negotiation between a subcontractor and a prime contractor, but what we've tried to do is to create a level playing field for that negotiation to take place, so actually they can't do without some of you. I mean, of course, there won't be a place for every single voluntary sector organisation. I can't deliver that. But there has to be a place for some. And so, therefore, they cannot impose unrealistic and unfair terms and conditions of business on you. So I'd go back and feel strengthened in the discussions if I were you. In terms of creaming, the whole point about paying loads more for the hardest to help is that actually the money is to be made by not creaming. If you can make £14,000 for working with some of the most challenged people, your margin should be better than working with a conventional job seeker. So I genuinely believe that turning this around and for the first time having a genuine differential structure for payments should mean that the desire to cream is much diminished. You can never say it's not going to happen at all. I mean, human nature says if you've got two people working with you and you want to get them into work and one's going to get there easily and one's going to get there less easily, you may concentrate on the first one first. But the point is, under our scheme, the second one may carry a much bigger price. And so therefore the incentive to leave them out altogether is, I hope, gone. So that's what we've sought to do in that area. On the sustainment and employment front, the way the contracts are structured is that you can only get paid in full if somebody is sustaining work over a pretty decent period. And so the aim of this is to ensure that the providers are firstly working to get people into the right jobs, where they will fit and where it will work and where their skills are relevant. But secondly, at the end of a phone, dropping in from time to time and so forth, to make sure that any issues that arise are dealt with. Now, there's some really great work being done on a voluntary sector basis in that in the past. What we've done is, I hope, locked in a system that means that that is the norm across the whole of the welfare to work industry. And in terms of the payment approach, you can't really do that. And we can give you the freedom to do that. The analogy I always give is, look, there are two approaches to doing business. I've got a rock. I want you to move it from one side of my garden to the other. I can either approach it by saying, okay, I want you to move the rock by using this pulley to move it 10 foot this way, and then you've got this lever to move it that way, and then if you roll it over twice, or alternatively I can say, just move the rock from one side of the garden to the other, and then when you've done it, I'll pay you 20 quid. And my approach is the latter. But the actual amounts we pay have to be based to a significant extent on what is the saving we make in terms of benefits and what can we afford to pay, and that's what we've done. Go on, very quickly.
Can I come back on that? Just because actually what you could say is what you want is I want to get so many people I want to get more people employed. And it's up to you guys to design how you can do that and tell me how you're going to save me money and how I'm going to get paid, and therefore how I can pay you. Because there could be, say, demand-side solutions which aren't being addressed at the moment. There could be any number of other solutions. There could be different ways of structuring the benefit payments. So, for example, some incapacity benefit claimants are much more work ready than some, than some job seeker claimants. So there's a lot of different things. I do question whether you've taken this to its nth degree.
The truth is, to have kind of a black box approach to contracting as well would be unbelievably complicated and take vast amounts of time, and it would take us years to get it up and running. So I think you can do the black box approach to how the service is delivered, but you actually have to decide how much can I afford to pay for it, I'm afraid.
Okay, let's have another question. Yes, at the front here.
Hi, I'm Clarissa Dan from Caritas and another publication called The People Bulletin. Regarding the vacancy issue, it's all very well the third sector and other organisations forming consortia, but if the jobs aren't there, or there are less of them than there were, I'd be interested in a statistic that went with the 5 million that were on benefits over the 10-year period. What was the vacancy level over the same period? Did that fluctuate at all or not? Other point is, I attended a conference recently for people with blindness and visual impairment, and one of the things that came up there was the issues faced by those people in getting reasonable adjustments so they could go and get a job and overcoming prejudice in the workplace. I think that's quite a big one for getting some of the disabled people off benefits.
Thank you. Questions at the back here.
Elizabeth Balgobin. I've worked around worklessness for more years than I'd care to mention, actually. I welcome that you're taking forward the Merlin standards. People were talking about that before you were in government, and it's good to see. And certainly, if it stops the stuff that was happening with prime contractors in the past, who then use contractual terms to say that our model is now changing and you no longer fit, that would be great. My question is around your powerful idea itself. Innovation, by its very nature, is risky, and I don't think it ever happened in Whitehall. What happened is it happened on the ground, and we then spent a lot of time trying to convince Whitehall to take it up. By decentralising, what you are losing potentially is the sharing of good practice, and this setting up of consortia that are all busy reinventing the wheel worries me.
Thank you. One on this side. Was there any? No? No? Okay, there was one back there, yes.
Hi, I'm Andy Legon from Champollion. My question is about personalisation. I was wondering what thought has been given to include personalised budgets in welfare to work, allowing people to commission the support that they think they need.
Okay. First of all, on the jobs front, the answer to your question is that employment in the UK rose by between 3 and 4 million over the course of the last decade. And in that time, it really depends on which of very many answers, most of which were given to Frank Field, who was following this fairly diligently, you actually followed. But it was anything between 60 and 80% of those went to migrant workers. So, the clear evidence that actually there have been extra employment opportunities, but what we've done is fail to get the long-term welfare dependent into work. Are there enough jobs now? Employment is 200,000 higher today than it was a year ago. The Office of Budget Responsibility forecasts are for an increase in employment of 1 million over the next 4 years. But even in the depths of recession, if you look back at the early 1990s, and I've not done this analysis for the recession that's just been passed, but in the recession of the early 1990s, even at the highest point of unemployment, there were something like 700,000 people a year moving from 3 months or more on benefits into work. Now, my view is that the labour market is constantly fluid, and that the real imperative is to make sure that a generation of people who are longer term unemployed don't get left behind. I want to get those people into the flow of getting into work, and that happens at all points on the economic cycle. You're right about prejudice in the workplace. There is a reluctance on employers to take on people who've got a particular disability or challenge in their life. It's something we've got to work to overcome. But I actually think one of the best ways of doing it, and one of the things that I hope that the work programme providers will be able to offer by forming partnerships with employers, you get the first person with a particular incapacity or disability or a health problem in their lives into a workplace and they do fine. the door is then open for more. And I've seen one or two really good examples of people with mental health problems or physical disabilities who've got into the workplace and done really well. And so I think it's really important that we do not write off anybody, and we make every effort we can, and the providers make every effort they can to create a ready group of employers who will give those people a chance. And actually the extra money they will gain from getting people with disabilities into work, I think, helps that. Good practice sharing. I don't think good practice sharing will disappear at all. I think actually, as the providers try and outperform each other, and we will make data available about how well everyone's doing, we'll need to do that. People will chase best practice. I think it will unleash innovation. You know, what I don't think we should have is a situation where somebody says, hey, we've got this really great idea, it's working well in Barnsley, why don't you and the DWP take it and spread it elsewhere? Because then you get a hugely convoluted process. It works because the guy over the fence next door looks across the fence and says, well, they're doing something rather smart there, I must do that too. And I think, you know, best practice spreads around industries without government getting in the way. And I don't see this industry as being any different. On the personalisation front, you couldn't do a payment by results system of the kind I've described on a personalised budget basis. And actually, you would end up with a very difficult system to manage, given the need to put people through a benefit system, provide them with benefit support. To provide then a personalised back-to-work budget would be very difficult indeed. So whilst I understand the theoretical potential, I think in practice it would be impossible to deliver.
Okay, more questions? Yes, one front here. Just here.
Mubin Hack, Trust for London and Chair of London Funders. One of the things, I mean, I agree with you, work is absolutely critical in terms of people's lives, but what you've not talked about is the growth of in-work poverty. So in London, we've seen a 50% growth of those who are in work poverty, actually living on low wages. And that's replicated across the whole country, where at least one person in the household is working. And I just wondered what the work programme was doing to try and address that. Because if the whole incentivisation is about getting someone into work, any job will do. Where's the incentive to get people into well-paid, good jobs? I don't really see that. You know, what's happening in terms of economy to try and stimulate growth in those sorts of sectors? So some comments would be welcome.
Okay, another question? Yes, in the middle there. Do you want to wait for the microphone? Just.
Minister, could I suggest...
Could you just say where you're from? And
Patrick Vigors, I'm a financial animal. I'm director of the company. Could I suggest to you that this is a bit like trying to cure cancer with an aspirin? It may have may alleviate the pain, but it doesn't solve the problem. Half the problem of employing people is they're ill-educated and ill-disciplined. And unless the education system is sorted out, you're wasting your time, because as rapidly as you get some bunch into work, a new lot come along who are equally unemployable.
Okay, another question, one right over there.
Hello, I'm Simon Marshall, human animal. But it does follow on to your question. And that's this.
Are you from an organisation?
Oh, yeah, I'm from the Big Lottery Fund. Sorry.
Right, thank you.
Your powerful idea is predicated on payment from results. And again, we've had some impact in payment results through social impact bonds and the prison projects that are going. And I totally get how they work when you focus the increasing resources on those with greatest need. You know, we're about getting to those most in need. What I'm not certain about, and this is where it comes to your thing, is how are we going to decentralise when we don't have the clear, almost blind relationships? We can get someone into work, we can test it for 2 years, the greater the need, the more money. So in areas such as education, where those with the greatest need have much lower starting points, how does this powerful idea cascade out to reach those broad, really complicated areas that build up the problems that cause worklessness in places like Liverpool that you cited earlier on? So I'm very keen to see how, is it always a market model, or are there other models that will allow decentralisation to take place?
Well, let me start with that. The exact model that we're talking about won't work in every part of the public sector and every part of social policy. There are areas where it obviously could do. Addiction is one example, where there is a clear financial benefit to government of dealing with addiction. Offenders is another area where clearly there is a potential financial benefit to the public sector of stopping people from reoffending. Where you have got a clear financial consequence of an adverse situation, you can build a payment by results model. You're right, in education it's less clear because the cost is much more deeply embedded. But what I would argue is that the changes we're pushing through, I mean, I've always believed that dealing with social problems is a complicated jigsaw puzzle of lots of pieces. The employment piece sits by far the biggest and at the heart of it, because when you start to get people into stable employment, you start to transform the lives and those who live around them. But no, I don't pretend this is a solution for every single part of government, but I think it can operate as an approach in a number of other areas and make a difference in a number of other areas. In terms of the employability otherwise, I mean, you're right. If you talk to employers about what they really mean by skill shortages, more often than not, they say what we cannot get enough of is good, motivated, employable people who will turn up at 9 o'clock in the morning and work hard for me all day. I can kind of shape them around the job I want them to do, but I want them to be there in the first place. And I see a key job of the work programme providers is to take very often groups of people who have grown up in an environment where work is not the norm, who haven't got work experience in their family, as being to re-motivate, re-energize them, and give them a window on what they can actually achieve. That is what the welfare to work industry is all about. It's not a functional process like Job Centre Plus. The role of Job Centre Plus is to try to match people with opportunities, to process the benefit system. Yes, of course, to provide people with some help and guidance and advice. But I see the work programme providers providing a degree of intensity and support and motivation that tries to get people to believe that they can do and find the things they can do well. That lies at the heart of what we're trying to achieve. Now, your point about the school system is absolutely right. The school system is delivering far too many young people without the requisite skills and qualifications, and that's what Michael Gove is seeking to solve as well, through the rapid move towards self-governing schools and the academy system, the introduction of free schools, the changes to the curriculum, the changes that will provide stronger discipline in the classroom. All of that's an integral and essential part of what we're doing. And I would argue you can't do one without the other or the other without the one. It's all part of a mix of policies that are designed to provide transformational change. In terms of in-work poverty, what I would point you towards in our reform package in dealing with in-work poverty is less the work programme, which is about moving people into employment. Though my point about the nature of the work programme is that if a provider doesn't get somebody into the right job, then the likelihood is much greater that they will drop out of it, and therefore the provider won't be paid. So there is an inherent incentive in there to make sure that you identify an individual and a vacancy and match the two together as closely as possible. You don't just shove somebody into any old job. But the thing that will make a big difference to in-work poverty, I think, is the universal credit. Because what it is designed to achieve is a situation where people always believe that if they work those few extra hours, if they get the pay rise or the promotion, that they're going to be better off. There are too many cases at the moment in the current system where somebody who does the right thing and does a bit more can end up being penalised financially or benefit virtually not at all financially. So it's the universal credit that I hope will provide people with a bridge out of in-work poverty. But I would always argue that even though many people who move off benefits into low-paid work are frustrated because they are in low-paid work, you're unlikely to get into higher-paid work unless you start to move up the ladder. And one of the things that is very frequently said to me by employment advisors in both the Job Centre Plus network and in the private and voluntary provider networks are that one of the things we try to do is to say to people, look, if we can get you into a job, then actually it's a start of a progress. And you get endless stories of, I got this person in as a shelf stacker and 12 months later he was running the fruit and veg department with 20 staff or whatever. And that's what we want to see. It's that getting people into work and helping them progress through work. And I think the combination of good skills development of the kind that the business department are now working on and the post-employment mentoring that's built into the work programme will help that happen.
Okay, another question. Question back there. And there's one in the middle here.
Hello, my name's James Fitzpatrick. I work for a grant-making trust called Roald Dahl's Marvellous Children's Charity. One of the things that we do is we support children with rare, long-term and life-threatening conditions. And one of the things that we note is, as many people will understand, is that very often parents and carers are unemployed or on very low incomes, mainly as a result of caring for a child with a long-term medical condition. I'm not sure if it's a question or a point, really. One of the things that we're concerned about is that the idea that you proposed about decentralising and innovation, and you've spoken quite powerfully about, not cream skimming and all of those kind of things. Our concern is that there are children out there we fund specialist nurses in the NHS, and this week one of our posts has just been ended by a decentralised decision-making process, and that's we understand already that's gaining ground. So partly things that other people have said, the ability to deliver your objectives is being undermined by decentralised decision-making, because it is about a pattern of support and provision that's around a family in order to be able to enable people in that family to work. And that has knock-on effects for the children and other people in the family as well. So it's just a concern, really, that I have that your idea, if it's rolled out to other areas of service, to other government departments, that there is a risk that if everybody decentralises, then there's a break point somewhere that undermines it at a local level. The other thing, just very quickly, I promise, is about you said that the part of your agenda is putting risk, transferring risk, and what I'm interested to know is how will you be accountable? How do you retain responsibility? And rather than just say, actually, it's the providers that failed. The contract, they didn't deliver the contract. How are you going to be accountable?
Okay, we had that question in a minute.
My name is Ros Dunn from the Thames Gateway London Partnership. I don't think anybody could possibly object or complain about the sentiments underlying the work programme, but I think as with a lot of other things, the devil will be in the detail, and I think some of the detail is going to be pretty devilish, to be perfectly honest. I wanted to just make two points, two questions. Firstly, I work in East London. Unemployment is going up in East London, so I think there will be particular challenges for making this work in areas where unemployment is already rising and in areas where the population there are some of the more challenging parts of the economy. But I think my real question is this, and it goes back to the point about innovation. I think an awful lot about decentralisation, which the previous speaker referred to, implies that at a local level, people will somehow find some way of coordinating and joining up. And there's generally a great capacity to do that. But most of my career has been spent in the civil service. And I think the civil service is spectacularly bad at doing that at national government level. And I think my question would be, the work programme is a great idea, but it clearly implies that other departments and other bits of your own department will work in a very joined-up, coordinated way to make sure, for example, that somebody who's trying to get somebody into work, another bit of the department isn't at the same time putting them in a position where they have to move house because they can't afford to live where they're living. So my question is, to what extent will national government do a lot of the joining up that is essential to make decentralisation work more effectively or at all?
Thank you. There'll be enough for one more question. So who's going to have the last question? Must be a taker, yes. Actually, there's one down here, yes.
Just building on that, really. You spoke, Minister, very passionately about Liverpool. But today I read that Liverpool has rejected the opportunity to be a pathfinder or flagship, I forget the phrase you use, as part of your big society, precisely because central government can't resist telling Liverpool what to do with that opportunity of being the big society flagship. So I'm just although I'm a great believer in what you're trying to do, I'm sceptical about the ability of the civil service and particularly national government to actually back off and let local government and local partners genuinely innovate and experiment.
Well, let me take that last point. I mean, I think Downing Street said this afternoon we want to take a closer look at the why. And I know Joe Anderson. He's a decent man, so I think we do need to explore what the nature of the problem is and respond accordingly. I have to say that there is a thriving voluntary sector in Liverpool that does very, very good work indeed. I've spent a lot of time talking to voluntary groups in the city, and I certainly would not wish to see Liverpool not play a part in what we're trying to achieve. And of course, the big society isn't really, I mean, it's meant to be bottom up, so we need to try and make sure that we can create an environment where the top doesn't get in the way. And learn lessons, and we won't get everything right, but it's a question of responding to things as they arise. And the response from Downing Street was very much, we'll take a closer look and work out why this is happening, and that's the right and sensible approach, I think. I think to jump to the lady's question, I think you were really, at heart of it, it's the question about housing benefit. The reason for the change on housing benefit is that we have got a situation where the taxpayer is paying, in many cases, tens of thousands of pounds a year to house people on benefits in the more expensive parts of town. Now that has two effects. First of all, it is clearly offering people on welfare an opportunity that is not available to their counterparts in work. But much more significantly, actually it makes it very difficult for them to get back into work. Because if you are living in an area that you could not afford to live in, if you were on benefits, then actually it's much more difficult to move somebody back into work. So I think the housing benefit measures are the right thing to do. I don't really see in an area like London that a change to the housing benefit rules, and this doesn't affect anybody in social housing. It only affects those people who are at the very top end of the housing scale, really in the more expensive parts of the capital, that in a city where there's a huge amount of migration to work, it should be a barrier to the work programme providers to get people into work. I don't believe that will be the case. And on the decentralisation front, I mean, look, there is of course an inherent tension between localism and uniformity of service. But I think our view is we've seen for the past decade that a centralised approach doesn't really deliver anything like the results it should do, and that actually devolving power to the front line, even though it leads to different people doing different things in different areas, has to be the way of delivering better quality services. And one of the things that I've certainly seen in my own area is when decisions are not taken anywhere near the local community, it's a matter of huge frustration to the people who live and work there. People want decisions to be taken close to their community. So I acknowledge the problem that you draw attention to. I'm not seeking to pretend in any way at all that it's not a real tension. But I think we've been there and done that when it comes to a uniform centralised approach, and I think that it hasn't delivered, and I think now is the time to push responsibility to the front line, accept that people will do things differently, but that is a better way of delivering across the board a high quality of service.
Well, Minister, thank you very much for that. I mean, on behalf of CCLA, London funders, and obviously all of you in the audience, I'd like to thank you enormously. I feel that you have really allowed us to engage with this issue, and I'm quite certain that there will be those who disagree with what you want to do, and no doubt they'll continue to put you under pressure, and those who do agree who will support you in your work. But I think, in any case, I think we will know a lot more about the details and the feeling that lies behind this through this process. So thank you very much.
That's right.
I just have to do, there's an advert which I need to give you for the next lecture in the Powerful Ideas series. On the 10th of March, we have Claire Fox, who is going to talk about happy, clappy politics and smiley faces, why the government's happiness agenda is putting society at risk. So a slightly different subject.
Perspective, isn't it?
But please do stay around for networking and canapes, and thank you very much.
Right.